Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about L-Deprenyl, the science behind a longevity intervention. So what is L-Deprenyl? It's a selective and irreversible inhibitor of an enzyme called monoamine oxidase B, or MAOB. This enzyme is responsible for breaking down neurotransmitters like dopamine in the brain. By inhibiting MAOB, L-Deprenyl increases dopamine levels, which is why it's used to treat Parkinson's disease. Beyond this, its neuroprotective properties have also been widely described, providing a strong rationale for its study in the context of aging and longevity. Research into L-Deprenyl's effects on lifespan was pioneered by scientists like Joseph Knoll in the 1980s. The meta-analysis, a comprehensive look at the data, to evaluate L-Deprenyl's effect on lifespan, a recent meta-analysis synthesized data from a large body of research. This study compiled and reanalyzed data from 22 rodent lifespan experiments conducted over 27 years in 6 countries using 8 strains of rodents, 4 species, and a range of doses. This is one of the largest bodies of evidence for a single intervention's effect on mammalian lifespan, providing a powerful, unbiased assessment of its potential. The meta-analysis yielded a clear and significant result. L-Deprenyl significantly increased the average lifespan of rodents. The pooled effect was statistically significant with a moderate effect size. While there was some heterogeneity, differences in results between studies, the authors found no evidence of publication bias, suggesting the positive findings are not merely a result of selective reporting. This indicates that L-Deprenyl is a robust geroprotector, showing consistent effects across a diverse range of studies. Key finding number 2, the importance of dose and age. Why did the results vary across studies? A meta-regression analysis helped answer this, explaining roughly 80% of the heterogeneity. The two most significant factors were dose and age at treatment initiation. Higher doses of L-Deprenyl were associated with a larger increase in lifespan. Age at initiation. Treatment started at older ages resulted in a larger, more beneficial effect on lifespan. This has important implications for translation, as it suggests L-Deprenyl may be particularly beneficial as an intervention in later life, and the dose must be carefully considered. The dog study, a test of translatability. Translation of findings from rodents to other species, including humans, is a fundamental challenge. The researchers reanalyzed a previously published dog study that showed a survival benefit from L-Deprenyl. However, when accounting for age at enrollment and sex, important confounding factors, the survival benefit, was no longer statistically significant. This may be due to species differences in drug metabolism or underlying aging processes. It's also possible the study was simply underpowered, and more significantly, powered studies are needed to provide greater insight into the translatability of these findings to other mammals. Proposed mechanisms of action. Dopaminergic system. It may protect dopamine neurons from age-related decline. Antioxidant upregulation. It can increase the activity of antioxidant enzymes like superoxide dismutase or SOD and catalase, which combat oxidative stress. Immunomodulatory effects. It can influence inflammatory and immune responses, which are key to the aging process. CAE activity. More recent studies suggest that even very low doses of L-Deprenyl can extend lifespan through its catecholaminergic activity enhancer effect, which is distinct from its MAO-B inhibition. It's likely that a combination of these factors contributes to its overall neuroprotective effect. Clinical use and dosing. L-Deprenyl or selegiline is not a new compound. It has established clinical uses. Parkinson's disease. It's used in combination with levodopa to exert beneficial effects on symptoms and potentially slow disease progression. Major depressive disorder. Transdermal L-Deprenyl is an approved treatment with similar effectiveness to other antidepressants. The doses most frequently used in the rodent lifespan experiments, 0.25 to 0.5 milligrams per kilogram, are roughly equivalent to the doses used clinically in humans, 1.5 to 3 milligrams for a 70 kilogram human, which falls within the range of approved prescriptions for Parkinson's and depression. Conclusion, a promising candidate for clinical translation. In conclusion, the findings from this comprehensive meta-analysis suggest that L-Deprenyl is a robust longevity intervention in rodents. Despite the lack of conclusive evidence from the dog study, a common challenge in translational research, its established clinical uses and safety data make it a particularly promising candidate for translation as a geroprotector. Future, carefully planned clinical trials will be critical to determine if these robust preclinical effects on lifespan and health span hold relevance for older adults. Thank you for listening. Please consider buying my book, 100 Pathways to Longevity, and subscribing to this channel.